Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye, a great place to be if you desire to take charge of your health so you can live fully while enjoying doing what you love. If this is your first time joining us, welcome. I'm Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of InTouch Primary Care in Sugar Land, Texas. And here we make it easy for people to achieve and maintain good health. We provide stress-free medical care so you can feel well and fit enough to chase your dreams. This whole month, we're going to be talking about a new topic, allergies, specifically environmental allergies. And I'm going to answer questions like, are allergies harmful? We're going to talk about, is there a cure for allergies? Are there things that you can do to help allergies outside of medications and so much more? I have very special things coming up this month, and I'm excited to share them, but we'll talk about that over time. So if you or someone you know has allergies, I want you to stay tuned for these series because they're going to be really helpful. You really don't want to miss this. We are talking about allergies. Last week, you got a chance to hear firsthand from someone whose child is undergoing allergy treatment with allergy drops. If you missed it, you can go back and watch it. It was really helpful. But today, I want to share more about allergy treatment for those that may have mild or intermittent allergies. So maybe you have allergies only at specific times of the year, or maybe you just have mild symptoms that are not too bothersome, or maybe it's only when you travel to a specific region or you're exposed to a specific thing. So about 2 episodes ago, I shared about environmental control tips that can be helpful, especially for those with pollen allergies, which is a very common one. But today I'm going to share tips about over-the-counter medications that can be helpful for allergy treatments. So now when it comes to medications now, you always want to check with your doctor, because even over-the-counter medications can have side effects, and some of them can cause interactions with other over-the-counter medications or even with supplements or prescription medications. But these are just guidelines that you can ask your doctor about. So again, over-the-counter medications for allergies has its place in allergy treatment, and it could work perfectly well for those who have symptoms, maybe for a few weeks or in a particular season. But there are a lot of brands, there are a number of combinations of medications, and sometimes it's confusing, right? So some people just try different things, and maybe they're just looking for the word allergy to determine what to take. But today I'm going to try and help so that you are doing it in a more systematic approach that will be more effective. So if you are just taking medications haphazardly, be careful, because sometimes you can overdose by mistake, especially if you're combining medications or you just are not addressing your symptoms properly. So hopefully this helps to avoid doing that. So there are 3 main categories when it comes to over-the-counter medications for allergies, and pretty much all of them are targeting symptoms. The first category is the steroids. So you may have heard of steroids, usually over-the-counter nasal sprays, steroid nasal sprays. And these are actually the most effective single maintenance therapy for allergic rhinitis. They cause the fewest side effects and at the few side effects at recommended dosing. So some examples of these are Flonase, which is fluticasone, flunisolide, which is Arabid, budesonide, which is Rhinocort, meclomethasone, which is Qvar, methomethasone, which is Nasonex, and triamcinolone, which is Nasocort. So there are many of them, but they pretty much have a steroid in the spray. And they are very effective for nasal congestion. They've been shown to be even more effective than an antihistamine or even an antihistamine nasal spray. So research shows that nasal steroids are better than oral antihistamine for nasal congestion, for blockage, for nasal discharge, for sneezing, for itching, nasal itching, for postnasal drip, and just all nasal symptoms. So the nasal steroids are very effective. But it's important to note that it takes a few hours to work and several days to get maximum effect. So you have to keep using it to get the best relief from it. So that's the first thing. So it's not an immediate symptom reliever. the other thing is it's all actually better to start with the highest dose, safest for your age. And then when your symptoms are controlled, you can lower the dose over time, usually every week until you get to the lowest dose that works. So that's different from how we usually approach a lot of other medications where we start at a low dose and go up. In the case of nasal steroid, you start at the highest dose that's safe for your age and you go down every week. The biggest drawback with most medications is side effects, especially with when you're using anything for a long time. So nosebleeds is a very common side effect from the nasal steroids. And there are also more serious side effects, like when it causes a perforation, like a hole in the divider, the septum between your nostrils. So that can be a serious side effect, right? So that's the biggest drawback. And so that's why with allergy medicine, I emphasize for people that maybe don't need to use it that often or are not using it for a long time, not for people that need to use something every single day. So that's the first one, the steroids. The next one are antihistamines, next category. So for antihistamines, the time you want to consider these is when you have itching or sneezing or runny nose. So when it's more about the itchy symptoms, when it's more about maybe sneezing and then you have a runny nose, it's less effective for nasal congestion compared to the steroids that I just mentioned, the nasal steroids. And antihistamine may be in form of a pill or a nasal spray, or depending on the type you need to take, you may need to take it once a day or several times a day. So for the short-acting pills, those are the ones that you need to take multiple times a day. So those are like diphenhydramine, like Benadryl, chlorpheniramine, and brompheniramine. The issue is they make you feel sleepy, they make you feel tired, they can impair performance, and they dry you out. So a lot of times we go towards the longer acting antihistamines. And the pills you may know, Allegra, Claritin, Zyrtec, so fexofenadine, loratadine, and ceratizine. So those medicines, those pills, are helpful because they don't cause as many of those sedating side effects. You're not quite as sleepy or tired. But the thing about them is they can cause you to dry out too. And especially some people experience dry eyes when using the antihistamine, even with the ones that you take once a day or twice a day. So there are also antihistamine nasal spray like azolestin, and this can be helpful as well. The only thing sometimes people don't like the taste of it, and so that's the issue with that one. But one major advantage of antihistamine is they work quickly. So most pills will be effective within 1 hour, and you usually will get maximum relief. Whatever relief you're going to get from that pill, you get it within 2 to 3 hours of taking it. So that's much faster than the nasal steroid. The nasal spray works even faster. In less than 15 minutes, you can get, relief from it, and you get it on demand. The drawback with medications, side effects. And sometimes side effects can be pretty significant with the antihistamines, especially with the long-acting ones, but all of them have potential side effects. They can make you sleepy, they can impair your ability to perform at your highest level. The first generation ones, that's like the Benadryls and stuff, they can actually associate it with weight gain in some people, and they can definitely dry you out. Thing about it is when you have dry noses and you have allergies, sometimes it feels stuffy. So that doesn't help when you have allergies, right? You're taking something to help you feel better and then it's causing you to feel stuffy. So for antihistamines, I always say they're helpful in the short term, but I don't recommend them for long-term use. So we've talked about steroids, we've talked about antihistamines. The last category over the counter are decongestants. So as the name suggests, it's helpful when you're congested. So there are only a few ingredients over the counter for decongestants. There's pseudoephedrine, there's phenylephrine, which comes in liquid and pills, and then there's oxymetazoline, which is a spray. So you can check for one of these ingredients. Pseudoephedrine is actually quite effective and at the over-the-counter dose compared to phenylephrine, but it lends itself to abuse and misuse, and there's been a lot of issues around that because it also is a stimulant. So people have, especially in the sports world, it's been abused, and so it's not as readily available as the phenylephrine, but it is pretty helpful for congestion. So a good rule of thumb for decongestants is try to avoid taking a decongestant in a combination medication. And there's one exception to that, but if you see, for example, a medication like acetaminophen, which is Tylenol, or a cold medication that is including a decongestant, I would stay away from those and do one that has the decongestant all by itself, or the only exception is if you have a decongestant with an antihistamine, like one of the ones I mentioned above. So the reason why is when you take the decongestant with a combination medication, is very easy to overdose on things, because when you're combining things, when you're doing combination medications and you're not separating them out, you may be getting too much of one, or including things that you shouldn't be including in your treatment plan. So, but with antihistamines, that's okay, because taking a decongestant with an antihistamine can actually help your symptoms. So the only other issue with decongestants is it's not safe for everyone to take. It can actually cause pretty serious side effects in some people, especially people that have high blood pressure. It can make your blood pressure higher. It can also cause insomnia. It can cause you to be irritable. It can cause headaches. So not everybody should be taking decongestants. So you need to be careful when you're reaching for allergy medications if you have high blood pressure, or if you have other conditions that make it unsafe for you to take a decongestant. So that's important to know. So for those who have symptoms for a few weeks, or those who have symptoms in particular seasons, you can start by, seeing what symptoms you have and making sure you're picking the right medications that will address your symptoms. Then you should consider your medical conditions, you should consider your side effects, and then work with your doctor to choose an option that you can tolerate, but avoid using them long term. So if you're already doing these things though, and you continue to have symptoms, or if you're concerned about the side effects, or especially if you're taking over-the-counter medications a lot or frequently, or if you have asthma or eczema, then you should consider a more permanent solution to allergies, like allergy drops or allergy shots. And I'm going to be talking more about that next week. So if you're anywhere in Texas, the next step is pretty straightforward. If this has helped you, help someone else, share this video, and if you need it, contact us for testing and for treatment. You can call or text us at the number in the caption, or you can schedule a free 15-minute consultation. So everyone really deserves to feel good and live a healthy lifestyle. Imagine you can breathe better, you're more comfortable, you sleep well, you can go outside, you can play sports, your head feels clearer. Allergies are certainly worth addressing, and I hope this helps. I'll be back next week and we'll discuss more about allergy treatment.